And of course, that was Dr. Mohammed Abdullah Nasser, who's coming to us from, of course, the Saudi British Hospital. And as he said, there are many things going on in the field of plastic surgery. But before you have any procedure, do your homework, and more importantly, do not be afraid to ask your doctor or your surgeon any question at all. We'll be going on a short report about plastic surgery. We're going to go all the way to Paris. Do stay tuned. We'll be coming back here in the studio, joined with yet another special guest.
Few people would dispute the fact that our world has become increasingly dominated by the cult of the flawless body image. Media and beauty industries have been playing a major role in dictating the rights and wrongs of physical appearance, and more people are finding it difficult to resist the new dictates of beauty. In the Western Hemisphere, where life expectancy is higher thanks to medical and scientific developments, a sizable number of people are resorting to plastic surgery in order to keep younger looks. Infamous cases of failed surgical operations have tarnished the image of an industry which was originally aimed at the improvement of physical well-being and the restoration of bodily functions and forms. In an attempt to address the myths and misconceptions about plastic surgery, we spent a full day in a Paris clinic with Dr. Marito, who's carried various cases of plastic surgery and who has agreed to open the safely guarded world of cosmetic surgery.
Plastic surgery should be put in context of reconstructive surgery as a whole. My university professor used to say that reconstructive surgery consists of repairing damaged parts of the body to what they used to be prior to the accident, while aesthetic surgery is improving the appearance and enhancing the general well-being of a person towards an aesthetic ideal.
In France, where plastic surgery is no longer a taboo, the number of operations has nearly doubled in the last couple of years.
To give you an example, each year we operate 15 to 20,000 people with breast implants. Plastic surgery techniques have improved. Today, our main concern is to make people look as natural as possible with the implants. The results are outstanding. No more scars or pain, and as a consequence, we have a growing demand for plastic surgery. Men and women and children, but this is hardly mentioned in the press.
New cosmetic surgery techniques and wider media coverage have reconciled more people with the doctor's knife, but they've raised as many ethical and moral issues.
More plastic surgeons use laser scalpels to operate. This means more procedures, less pain and bleeding. There are inevitable moral questions that such operations arise, but we need to remember that plastic surgery has recently made groundbreaking developments in reconstructive surgery, particularly face skin graft. We've helped many people regain hope.
Dr. Marito operates both reconstructive and aesthetic cases of surgery. He says he does not distinguish between people who wish to improve their appearance and those who need to reconstruct damaged parts of their bodies.
Plastic surgeons are primarily trained in reconstructive surgery, but many carry aesthetic surgeries as part of their profession. Sometimes I operate patients suffering from breast cancer.
We're about to attend two of the most common operations in plastic surgery. The patients in both cases are women, and some of the images, of course, are sensitive. So we're going to show you just what the eye can bear. Liposuction of mid and upper back is mostly common among women. It consists of removing pockets of fat from those areas which are resistant to diet and exercise. The operation takes about 30 minutes, during which Dr. Marito removes the undesired fat, circled in blue on the picture, from his patient's hips.
We spend more time on male patients who wish to have a liposuction. Their fat, particularly in the belly, is more condensed and requires more physical effort from the surgeon than with women patients.
Rhinoplasty or nose surgery is another popular procedure in Dr. Marito's clinic. Patients with nose defects undergo a sensitive operation to improve the appearance and proportion of the nose. Dr. Marito explains that his patients are briefed in detail on all aspects of the operation.
We follow our patients closely for a period of 15 days after the operation. We also maintain contact with patients who live abroad thanks to new communication technologies.
Plastic surgery can be very expensive and may yield negative results. It is therefore very important for patients, says Dr. Marito, to carry extensive research and choose reliable surgeons with a known record before taking any decision.
Some patients choose to travel to countries where plastic surgery is cheap, but where quality and safety criteria are not respected. I feel about those people because they often jeopardize their bodies in order to have money. Sometimes they come back with complications and we have to operate them again. Of course, plastic surgery is expensive, and France is surely not a cheap destination in this field. But one has to make the right choice when the result depends on the efficiency of the operation surgeon and team. A good surgeon's reputation on the market should be a priority for people who consider having a plastic surgery.
Plastic surgery remains a polarizing issue in many cultures. So before you entrust your face or body to a surgeon, you might need to understand all the intricacies and details of the operation you wish to undergo. And don't hesitate to take a second opinion in case you are still in doubt. Reporting for Good Morning KSA from Paris, this was Qusay Al-Kadri.
Welcome back, and here in the studio with us is joining Dr. Huda Bersaidi, and she's a gynecologist who is going to give us information about birth control pills and contraception. So let's talk to her and welcome her to the show. Good morning, doctor. How are you doing?
Good morning. How are you doing? Fine,
good.
Thank you. Everything's
so,
okay.
Doctor, could you please give the ladies your advice and the awareness of the wrong using of the birth control pills?
People think that birth control pills should be taken and then they have rest and then they take again. This is wrong idea. So they should take regularly in order to regulate birth control and also to regulate cycle. So birth control should be taken regularly and after the advice of the doctor. They shouldn't go and take from the table and from the pharmacist and then she start whatever she likes and she stop whatever she likes. This is very dangerous according to contraception.
Okay, so one has to go and consult doctor before starting any kind of contraceptive pills, right?
Yeah, she should.
Okay, and what can you tell us about the idea, which is like, so we have this common concept, which is when we use contraceptive pills, well, we do hear from people that they put on weight. So what would you like to say about that?
I will tell you that some contraception, they are giving some increase in weight, but there is new generation, the only giving weight is the progesterone part. This is some active ingredient in the contraception. The contraception is two parts, estrogen and progesterone. This progesterone, the new generation of progesterone, so they are designed so they cannot increase the weight of the users. So the new generation, they are not giving the woman more weight, and this weight is not a fat, it's some sort of salt and water retention. And it's, if it is in the old generation also, it is not more than 2 kg, and most probably she will lose when she has her menstruation start. So it's a wrong idea, and also the weight increase because the woman relieves from the headache of that she can get pregnant and everything is controlled in her life and she feels relaxed. That's why she gain weight and she start to feed not properly. She should also watch her diet.
Concentrate on the diet, yes, and follow a healthy diet plan. Diana, what would you like to ask?
No, I do agree, and very important, Dr. Huda. We know what birth control pills are, but could you give us an idea, ma'am? For example, we know that birth control pills are they're pills used, for example, for family planning. And more importantly, they're also used for controlling your menstrual cycle. But can you give us an idea, ma'am, about why do women who are not planning, who are not using it for family planning, why do other women use birth control pills? Or what aspect is it good for?
You know, birth control pills has many advantages, like it can regulate the cycle. It's one of the treatment of one famous condition known as polycystic ovary. It regulates the cycle. They have amenorrheas for long times, and this will affect the health by negative effects. That it will affect the bone negatively, it will affect the health, and it will affect the hair, the skin, and everything of the woman is controlled by this balanced estrogen and progesterone. If this estrogen or progesterone there is imbalance, so it will suffer in all of her body. So birth control can be used for regulate the cycle.
Good.